Good afternoon or good morning to everyone on the line. Welcome to today's webinar presentation, Turning to Community Partnerships to Support Students During and After COVID-19. My name is Maria Noesti and I will be your host and moderator. Before we begin, I'd like to go over a few housekeeping items. First, today's presentation is being recorded, so don't worry about taking any notes. We will send you a copy of both the recording, the slides, and any resources covered in our follow-up. Next, during today's presentation, attendees are in listen-only mode. However, we have dedicated time at the end for questions, so we encourage you to use the GoToWebinar interface to submit as many questions as possible throughout the conversation. Now, I'd like to introduce you to our presenters. I am joined by Mariam Mossman, who is a project director for the Otsego County System of Care. In her role, she oversees a SAMHSA System of Care expansion grant awarded to Otsego County Community Services in 2018. The grant unites schools, healthcare, government, and community-based organizations to improve the behavioral health outcomes for children and youth with serious emotional disturbances and their families ages birth to 21 who live in the Otsego County, New York. We're also joined by Aaron Sorensen, who is the director of the Catskill Regional Teacher Center. He has been a special education teacher for nearly 20 years and has worked in both private and public schools. Aaron serves teachers in 35 school districts, private schools, and 3 colleges, providing professional development opportunities for educators to improve their knowledge and effectiveness. As one of the 125 teacher centers in New York State, the CRTC is independently governed by a policy board required to be at least 51% teachers, so truly by teachers for teachers. Last but not least, I am joined by Sabrina Jonkov, who is a K-12 strategic account manager here at Kognito. A passionate advocate for mental health, Sabrina is grateful to be part of a company that uses technology and conversations to improve social, emotional, and physical health outcomes. After joining the Kognito team in 2019 as a business development representative, Sabrina now oversees K-12 clients across states in the Midwest and the Northeast as a strategic account manager. I want to welcome our presenters, and I'll now turn it over to Mariam Mossman to get us started. Take it away, Mariam.
Thank you so much, Maria. I appreciate it. Thank you, Sabrina. I want to thank you all for inviting Aaron and I to talk today about not only the Otsego County System of Care, and share how we've developed our partnerships and expanded our service delivery system to help meet the needs of our youth and families, but also how we have used Kognito to help meet that need as well. You know, whether you're living in New York or New Jersey or Pennsylvania or Florida for that matter, I think you'll find after listening to today's webinar that the strategies and framework that we will present today can serve as a model for your community regardless of where you live. So the actual service delivery system might be a little bit different where you are, but I think you'll find that our model and how we can use and are using Kognito to support our youth is applicable to where you live. So let's get started. As Maria said, I am the project director for the Otsego County System of Care, and we were awarded our SAMHSA grant in 2018 through the Otsego County Department of Health from SAMHSA, and the purpose of it is to, as Maria said, to unite schools, healthcare, government, and community-based organizations to improve the behavioral health outcomes for children and youth with serious emotional disturbance and their families. The slide that you're looking at, it may look a little bit like your community. In so many communities across our country and the nation, our child serving system looks like independent silos that don't often communicate together. They're inefficient at times. They often result in duplication of services, lack of coordination, and probably more importantly, confusion for our families and youth that we're serving. So this is not very efficient, nor very helpful. And if I could ask you to forward to the next slide, I think what you'll see is our system of care modeled after the national framework. So the system of care is a national framework. It's a coordinated network of services. I'm not going to read the slide to you, but it is a support that's organized to meet all of the physical, social, emotional, mental, education, and developmental needs of children and families. The key is that it is not a program. It's not a new service that requires funding. It's a philosophy. It's a framework that is meant to establish and create a cohesive, unsiloed system of care that supports our youth. Common cross-system partnerships with common goals. It's family and youth guided. It's community-based. As the slide points out, it's culturally and linguistically competent to reflect the needs in your community and your specific area of service. Our partnership really started back in 2016. So we were awarded the grant in 2018, but in 2016, with the vision of our Director of Community Services, Susan Matt, who convened several groups and stakeholders, mainly comprised of schools, child serving agencies, and additional stakeholders as needed. They started the discussions around what the needs were of the youth, especially at-risk youth. And by coming together, what we learned and starting the conversations and building the team around the common goals, we learned that we didn't necessarily speak the same language. For example, a school district identified that they needed social workers, but they had a different understanding of what a social worker does compared to the outpatient licensed mental health clinic social workers. We learned that we needed to establish a shared language so that we could really identify what the needs were. And in doing so, we clearly identified the objective and what the needs of our youth and families were. In Otsego County, we decided to focus most of our initiatives around our schools. And as a small rural geographic area, schools are often the main hub of our communities. Without a school, there's no common magnet to pull people together. But serving kids is broader than just the bricks and mortar and the buildings and the school districts. So it really was important to build that trust and that relationship and understanding around all aspects of each organizational change and challenge, and find that common ground that connects us all. So in 2018, as Maria introduced in this webinar, we were awarded the SAMHSA grant and began to in a more solidified manner, build a cohesive formal system of care. With schools as our focus and youth and families at the center, we developed, if you could turn to the next slide for me, we developed the Behavioral Health Resource Center, and comprised of the licensed clinicians serving all of our school districts. And I'll take just a second and explain a little bit about this slide very briefly. At the center, of course, is our kids and families. And around that, the bubbles or circles, if you will, are designed to be transparent, because that's part of the communication strategy, is transparency, accountability, openness, honesty, trust, relationships. And in our community, I won't get into the details because you can see them and we only have so much time this morning, but we built our core group of partnerships and then built out from there. And again, our grant serves birth to 21. So it's not only the school districts, but it's the younger early intervention child serving system as well. And the red identification in the New York State map is where we are located in New York State, Otsego County. If we could go on to the next slide, please. So again, in the spirit of time, our Behavioral Health Resource Center is a group of clinicians designed to support the hub of each school district by uh, providing not only clinical services, but some case management and linkage to additional community-based resources. I am more than happy to answer any questions regarding the services specific at the end of the webinar, but I want to make sure that Erin and everyone has a chance to ask any questions at the end. So we can always come back to the specifics on this if that's all right, Sabrina. Moving into the next slide, we also built in our system of care what's called Choices. It's a collaborative hub of integrated community empowerment services, mainly for our birth to 5 age group. It is a family peer partner that serves as an integral part of connecting and linking, almost a one-stop shopping, if you will, for families who have needs and support. And what this design is that peer partner would also be able to follow that family through their school years, so that the family doesn't have to tell their story over and over and over again. So many times we see that as a challenge for families where they're in need and they have to go from provider to provider, again, that silo, right, where they have to tell their story over and over again, and it becomes discouraging for families. So this concept is a collaborative choices. It's family-led, peer-led, and it's nothing like walking the walk, if you will. So that's another part of our key system of care. If we could go to the next slide. Our system of care, again, focuses around 13 different school districts, incorporating BOCES and all of the districts in our region. Back in 2018-19, the school districts identified, again, that partnership, right? Those stakeholders all meeting together on a regular basis. The staff and leadership at the schools, the superintendents, really identified compassion fatigue as one of their main focus area to support their educators, which in turn, of course, supports our youth. And then the pandemic hit. Of March of 2020, our schools in our region, as in most of New York State, were shut down. March 13th, to be specific. What we found is that Kognito could not be a more timely tool to support our educators who were, before COVID, facing pandemic compassion fatigue and being really having a lot of challenges reaching out to kids at youth and youth at risk. So Kognito was the way that we chose to help empower teachers and guidance counselors, caregivers, child serving agency staff with the tools that they needed, the skills to connect with their kids and to support the kids at a time when, due to COVID, social isolation and a change of their routine was really, really disrupting. So schools have now identified this as part of their top priority, and the need to support the social emotional learning and needs of their kids. So with schools as the hub of our grant delivery service, we're in the process now. We've started about 3, 4, or 5 months ago of rolling out Kognito in schools and all across the child serving agencies. So Head Starts, early intervention, the school districts themselves, the daycare providers, anywhere that we can commonly come to talk with families and kids about how to support them. And part of our key to this service delivery has been, again, partnerships and partnering to deliver not only Kognito, but to continue to build that shared language and understanding and commonality around meeting kids and families' needs. We formed a very strong partnership with Catskill Regional Teacher Center. My co-presenter today, Aaron Sorensen. He's invaluable, and his mission of his agency is invaluable to deliver not only Kognito, but to help us connect with educators in a different way. So at this point, I think I would like to turn it over to Erin. I don't know if Sabrina, if you want to introduce Erin, or if Erin will be self-introducing, but I'd like to turn it over to Erin to talk more about what his role is, not only in our partnership with the system of care, but in implementing Kognito. Erin, it's all yours.
Thank you, Miriam. Thank you everyone for coming and allowing me to come speak with you today. I am Erin Sorensen, the director at the Catskill Regional Teacher Center. I'm deeply passionate about the concept and mission of teacher centers and welcome every chance I get to talk about our mission. New York State codified the existence of teacher centers by creating Ed Law 316 in 1984. Fundamental to teacher centers is the notion that teachers know their needs best. To preserve the heart and integrity of that concept, that it should be for teachers by teachers, this law requires that all teacher centers be overseen by a policy board that must be comprised of at least 51% teachers. So truly it is teachers by teachers for teachers. Each of the 125 teacher centers found throughout New York State looks and operates differently. Some centers are single districts, and others are multi-district consortiums, and others are some variant in between. We provide resources and professional development services for schools in 5 counties. We serve roughly 3,000 teachers within a 60-mile radius of Oneonta. We have small rural schools with a large population of students receiving free or reduced lunch. Our smallest school employs 17 teachers, that's K-12, with our largest employing 167 teachers. As stated here on the slide, teacher centers play several important roles not duplicated elsewhere in education, supporters say. They offer teachers immediate practical help with the difficult day-to-day problems encountered in the classroom, an uncommon opportunity to exchange ideas and seek help in an unthreatening environment, an inexpensive way to identify and study the curriculum material they believe is most important to their work in the classroom, and a respite from what is sometimes described as the demoralizing isolation of the classroom. We believe schools are served best by teachers who seek out resources and are empowered to return those resources to the classroom. So let's take a look at what that looks like. Thank you. It's very difficult to get into schools. In fact, one set of doors is no longer enough. We now need 2 sets of doors. The challenge to get into schools is not limited to the physical environment. It also applies to curriculum and school programs. Typically, for a program to be implemented in a school, an organization will contact the superintendent who will evaluate the program, and then he or she will ask their principals for input. Principals ask teachers for input, and the information travels back up the chain of command. School administrators may be reluctant to implement the program. If the program requires teacher leaders, typically the administration will select a teacher to be this leader. While this may lead to resentment. Either it's a great program in which other teachers say, well, why was that person picked to lead this project? I'm just as good. Or if there is no buy-in from other teachers, the teacher selected feels that it's punishment. We say, let's flip the script. Sell the program to teachers. If the program is good, the teachers will bring their project to the administrator. They are excited and have buy-in from the start. Then they will work collaboratively with the administration to work out concerns and implement the plan. In some cases, with tight budgets, teachers may be so passionate about a project, they may not even seek compensation to implement it. Payment for them is recognition and a title. Education funding continues to shrink relative to inflation with an ever-increasing amount of mandates. Supports for teacher development continues to be eroded. Our budget does not support a full-time director with salary and benefits. We must do more to innovate and collaborate. I'm going to turn this back over to Marion in a moment, but before I do that, I just want to add a few more things. The Otsego system of care helps to provide some financial support to the Catskill Regional Teacher Center to allow me as a director to help implement the Kognito. This allows me to stay employed while alleviating the need for an employment search. There are more added benefits to the partnership too. With the Otsego system of care, we have partnered with mental health providers to provide mental support for our local educators and school personnel. This connection allows teachers to better understand the healthcare system and for employees of the healthcare system to better understand teachers and schools. We are also returning to the values of strengthening personal connections. When a student struggles in school, school personnel can call the county or they can call a friend and a partner. I can assure the student and say, I know Kelly, she's wonderful and caring, and I feel really comfortable leaving you in her hands. Or it can be clinical. I'd rather it be personal. We also have changed our bylaws to add early childhood representatives, allowing us to offer our services to early childhood teachers. So this is something that we would not have done without the partnership with Otsego System of Care. With administrative approval, the CRTC can provide continuing education credits and support teachers through Kognito process, freeing up school administrators to work on other tasks. With Kognito, Otsego System of Care, and the Catskill Regional Teacher Center partnership, rather than an unfunded mandate, this is a fully funded, financial, and systematically supported program. Thank you, everyone, and I'm going to turn this back over to Marion.
Thank you, Aaron. You know, as we talk about the work that the system of care has done or is doing, we are in year 3 of our grant right now, and the partnership with not only Catskill Regional Teacher Center, but what Aaron speaks about in terms of adding the policy changes and its innovation, its collaboration and innovation. And it comes from the conversations. It comes from building those relationships. Now, I'm pretty sure I'm not saying anything new to anybody on the webinar. I'm pretty sure that all of you are nodding your head saying, yep, okay, yep, tell me how we pay for this, right? Well, some of it isn't about money. In fact, some areas have used CARES funding to buy Kognito. But the innovation and collaboration in the building of the system of care is around the discussion and shared language, as Aaron has said. It's about this slide right here of innovation and collaboration. We didn't start out with all these partners. We keep adding the circles to it. And again, in a transparent way. We started with youth at the center, with families, building out with Catskill Regional Teacher Center and schools. You know, I'm not a teacher, but Aaron and his policy board bring that perspective and value and language to the discussion and offer things that we didn't think about. And I think it's timely. Actually, I received a communication in the email just this week about Kognito. And if it's okay, Sabrina, I'll share this really quickly.
Please do, thank you.
One of the teachers who recently took some of the at-risk courses in Kognito shared that the scenarios and the simulations through Kognito were very realistic. She's personally had very similar conversations with students, but the offered responses were they were realistic. And one of the things that she learned is that the order in which things are discussed with the student are probably more important than I realized, such as empathy, validation, shared stories, and advice. Teenagers are especially hard to get to seek help. And this particular teacher liked how the high school scenarios coached her on how to get resistant teens to let go of some of the stigmas attached to counseling so that they could seek help. That's powerful. And to be able to connect with kids and families in that way gets to the passion of what we do and why connecting is so important. It allows us to then have that conversation to further innovate and collaborate and bring on those youth who then become leaders in their own way to teach other kids that it's okay to seek help and to empower the educators to know how to talk to them and what helped. Erin, I don't know if there's some things you want to add to that in terms of innovation and collaboration, but we are still building. Our system of care is not done by any stretch of the imagination. We're still going. Erin, do you want to add anything to that?
I think I'm good. It's just so important that we just bring all stakeholders to the table.
Yeah. Yeah, I agree. And you made a very valid point, Erin, and that is that schools often don't allow everybody in the building, right? You didn't quite put it that way, but it's about trust. In many of our schools and rural communities, the school personnel are very protective of their kids and families, as in their family. And having that common shared language and discussion is so important, that we're all coming to the table speaking the same goal and working toward the same goal and being accountable in those outcomes, so that we're really working together. It's not just talk, it's really about deliverables as well, and building that rapport. So I think for me, I know we're beginning to wind up a little bit here. I think for me, building upon those relationships, partnering with our families, I can't share enough the importance of putting the kids and families first and really listening to them and responding to what those needs are, and building, empowering and building the needs around that. And I think oftentimes people say, how in the world did you do this in the middle of a pandemic? How'd you, right? I mean, that was what this is partly about. Well, I guess I'm an optimist. And, but I think really my view, and I think probably most folks watching this today have the same thought, and that is that through adversity or crisis comes opportunity. And by listening and partnering with the folks we were able to respond, and we chose Kognito as the way to do that, to meet the needs of our service delivery system. So partnering for sustainability and responding to those needs and connecting the dots, so important.
Thank you so much, Marion. So I'm just going to hop in very briefly here. I know we only have a few minutes left. First of all, I just want to thank both Marion and Erin for their time. I really do count myself as very fortunate to be able to spend my days speaking with educators and administrators like Marion and Erin, who are clearly so passionate about their school communities. So thank you again, and thank you everyone on the line as well. So you didn't sign up for a product webinar, so I'm not going to go in too deeply, but I did just want to provide a little bit of background, especially after hearing, how the system of care has worked. Also hearing that that great testimony from the teacher that Marion shared. So, quick overview: our mission here at Kognito is to combine the science of learning, the art of conversation, and the power of virtual human simulations to measurably improve social, emotional, and physical health. So we work in the K-12 space, the higher ed space, as well as healthcare. Go ahead and hop to the next slide. This is really just our approach to the K-12 space. As Marion mentioned, as of last year, we are also working at the pre-K level. So I know a lot of districts have pre-K and TK and other early childhood programs. And just looking at this kind of scaffolded approach and how we can support school communities with a variety of programs. We're able to offer very tailored learning paths to school communities depending on their needs, whether trauma is a focus, SEL, bullying prevention. We really partner with you to create the best plan, and to be able to kind of build on that year and year, so that you can have a community of teachers and staff members that are really equipped to have these powerful conversations with students. Next slide. So this is just really briefly how our Kognito simulations work. Again, in that teacher testimony, there was a little mention of the dialogue options. So in a simulation, you're gonna, interacting with a fully animated student, these students are, they have memory and they have emotion, so they're going to react to everything you say in the order in which you say that, and they're going to use body language, and you need to respond to that. So I think the great thing about this is that, you know, it's virtual. This is the safest space you can do something like this. I think a lot of times when staff members are told to, you know, do this in a role-playing activity with each other, that can really be a barrier for entry to learn some of these skills, because people just don't always enjoy role play. But you know, with this, you get to undo your conversation selection. So if this student Charlie here really shuts down because of something you said, you can undo that and, you know, try to go forward through the conversation path and, you know, get that feedback and see how she responds. There's a little coach at the bottom who's going to pop up and give you feedback. There's an engagement meter to see kind of how successful your subsequent conversation choices have been. I like to tell people that there are not right or wrong dialogue options in this. There are just more and less compassionate choices. And if you make, you know, too many choices in a row that aren't super compassionate, you know, you are going to get a bit of a force undo, so that you aren't just told at the end, oh, you didn't do well. You're actually being, you know, repathed through that, so you're actually practicing ultimately the best way to engage these students and have these conversations. Yeah, go ahead to that last slide, I believe. So again, this is what we're, you know, what we're looking at statistically, especially with the system of care. They have our full suite of K-12 products, so you'll be able to look at these more closely when you see the slide deck. In addition to, you know, the front-to-front curriculum that we have for high school students, we're growing that out to have a substance use and school violence prevention module. And then again, you know, everything for every grade level, and most of the topics that are probably of interest and priority. We also have a few modules that are for parents and caregivers, and that, you know, is a growing interest in our product catalog and our product roadmap, especially as, you know, parents and caregivers are perhaps more in tune than ever with the pandemic and asynchronous learning at home. Perfect. And is that our last slide? Yes. So yeah, so thank you again. I know if Marion and Aaron have any additional comments, speak now.
I just want to say thank you for letting us come and speak to everyone. Like you had pointed out, we are deeply passionate about what we do and just love the opportunity.
Thank you guys, truly.
I'll second that. And if anyone has any questions, our contact information is on the slide as well. Please feel free to reach out. We're happy to share what we've learned and give any insight with regard to our system of care, our partnerships, our challenges, and how we're rolling out Kognito. So I just thank you, in addition to Aaron, for the opportunity to talk about what we're doing.
Awesome. Thanks so much. And we will share that contact information.
Great. Thanks, everyone. Have a great day.